What's up, everyone? Welcome back to ShockDoc Medical. I'm Dr. Rod. Today, I've got a real treat for you. Ever wondered how something as simple as a nail exam can unlock secrets about a patient's health? I mean, have you ever stopped to think that your nails might be screaming out clues about drug effects, systemic diseases, or even congenital issues? Stick around, because today we're diving deep into the art and science of nail examination. Trust me, this episode is a must-listen for both doctors and curious minds alike. All right, so here's the rundown. We're going to talk about everything you need to know when it comes to examining nails, from the ins and outs of nail folds, nail plates, and nail beds, to what different changes might mean for your overall health. And yeah, I'm not just talking about whether your nails are too long or too short. I'm talking about real diagnostic clues that can point to drug-induced changes, systemic diseases, or even congenital conditions that might affect your hair, teeth, and even your sweating patterns. It's like your nails are little storytellers of what's going on inside your body. First up, when you're doing a physical exam, don't rush past those nails. Start by inspecting the entire nail unit, which means taking a good look at the nail fold, nail plate, and nail bed. Let's break it down. Nail folds. Check both the lateral and proximal nail folds. Look for any signs of erythema or swelling. With the help of a dermatoscope or even an ophthalmoscope, you can get a closer look at the blood vessels in the proximal nail fold. Trust me, magnification makes a world of difference. It's like switching from a blurry cell phone photo to a high-def image. Cuticle. Ask yourself, is the cuticle present, intact, and firmly attached to the nail plate? The cuticle acts as a barrier, and any disruption here can be a red flag for either local or systemic issues. Nail plate. Check the shape and color. Punctate white areas are pretty common and generally normal, but if you spot linear splinter hemorrhages near the distal free edge, that might be a sign of trauma. Observe the surface of the nail plate. For example, longitudinal grooves can often be seen in older patients, and while they're usually benign, it's important to note them. Don't forget about the thickness of the nail plate and how well it's attached to the nail bed. If you notice separation, which we call onycholysis, think about possible underlying conditions like psoriasis. Nail bed. Look underneath the nail plate for any hyperkeratosis or even tumors like subungual warts. This can be crucial for early detection of more serious issues. Every single one of these details can give you insight into whether the changes are acquired, perhaps due to drugs or systemic disease, or congenital. And hey, if you're seeing congenital problems, remember, those can indicate a wider ectodermal problem affecting hair, teeth, and sweating. Your nails really are the tip of the iceberg. Now, let's talk equipment. You don't need a fancy lab to do a good nail exam, but having the right tools can really boost your diagnostic power. Side lighting is a game changer. It highlights subtle changes on the nail surface that might otherwise be missed. And if you've got access to an ophthalmoscope or a dermatoscope, use it. These instruments help you magnify the blood vessels in the nail fold, giving you a peek at details that are otherwise invisible to the naked eye. It's like going from standard definition to ultra-high definition in the world of physical exams. All right, so you've done the inspection. Now what? Interpretation is key. Ask yourself, which nails are involved? If the abnormalities are widespread and symmetrical, that points more toward an endogenous cause, a systemic issue perhaps. But if only a few nails are showing changes, especially if it's primarily the toenails, then you might be looking at trauma or even a fungal infection. For instance, if you suspect a fungal infection, you'd want to take nail clippings for a mycological examination and culture. Now, let's say you get a positive result for onychomycosis. One common treatment for that is oral terbinafine. Typically, we prescribe 250 milligrams daily for about 12 weeks. Of course, that's just one option, and any treatment should be tailored to the patient's overall health and specific situation. And don't forget, nail abnormalities might also be drug-induced. For more detailed information on nail dystrophies and drug-induced nail problems, you'd typically refer to comprehensive texts. Let's bring this home. Why should you care about nail examinations? Because sometimes the smallest detail can unlock a huge piece of the diagnostic puzzle. Whether you're a primary care provider noticing nail changes in a patient or a specialist looking for clues to a systemic issue, these observations can be life-changing. Imagine a patient who's been struggling with unexplained symptoms, and the only hint of trouble is in the nails. Maybe a subtle discoloration or an oddly shaped nail plate. That's your cue to dig deeper. And if you notice signs like onycholysis or splinter hemorrhages, it might just be the first step in diagnosing something as significant as psoriasis or a trauma-induced nail dystrophy. On the flip side, if only a couple of nails are off, say in a patient who's an avid nail biter or works in a job with a lot of hand trauma, you might lean towards a more benign explanation. It's all about context, folks. And as always, a careful history and a detailed physical exam are your best friends. Now, I want to hear from you. Have you ever come across a patient with unusual nail findings? Or maybe you've noticed changes in your own nails that got you thinking twice? Drop your thoughts and questions in the comments below. Let's get a conversation going, because every bit of shared experience helps us all learn a little more. And for those of you just starting out in your medical careers, or even seasoned practitioners looking for a refresher, remember that these small details can lead to big breakthroughs in patient care. All right, folks, that wraps up today's deep dive into nail examinations. We've covered everything from the equipment you need, like side lighting and dermatoscopes, to the minute details of inspecting nail folds, cuticles, nail plates, and nail beds. We talked about what different changes might indicate, whether it's trauma, systemic disease, or even a fungal infection, and I even threw in a quick note on treatment options like oral terbinafine for onychomycosis. If you found this discussion valuable, please hit that like button, subscribe to ShockDoc Medical, and share this episode with your colleagues and friends. I'm Dr. Rod, and I can't wait to dive into our next topic with you. Next week, we're going to uncover another groundbreaking discovery that might just revolutionize your approach to medicine. Stay curious, keep asking questions, and remember, the smallest detail can sometimes be the key to a big breakthrough. Thanks for tuning in, and until next time, take care.